Hi, welcome to MedTech. I'm Ginger Kuchbaugh, the physician liaison that just did your post-evaluation consult for weight loss. So you've just ordered semaglutide. We talked on the phone. It was probably a lot of information and you might be feeling a little overwhelmed. So I wanted to make you a video to go over some of the highlights of our consult, and keep in mind that we will be in touch through email too. I am going to coach you through this journey. So the first thing I wanted to go over is nutrition again. I know I probably went into a lot of detail over the phone. I just want to harp to you how important it is that you take the nutrition portion of this serious. We never want you to have to diet again. We want you to be able to spend your money on anti-aging drugs that help with hair, skin, nails, keeping your muscles tighter and keeping you in that goal body at an easier pace. So really take this time when you don't have food cravings and when you're feeling full after small amounts, because that's what the semaglutide is going to do. Take this time to develop a healthy relationship with food. You're not going to be having any cravings, so start putting really healthy choices in there, because they're going to satisfy you in small amounts, and that way when you come off the medication, you're craving these healthier foods. And if you want to know more about balancing out your gut or the bacteria that's in your digestive system, please let me know in the email, and I'll tell you all kinds of tonics and foods that can help you get that balanced out a little bit faster. The next thing I want to talk about is your injections. So you're going to get an insulin syringe, which is just a tiny little needle, and you're going to inject a sub-Q injection, a subcutaneous injection, short sub-Q. So if you've never done one of these before, most people tend to stick in their stomach. I have heard from other patients that if they use their glutes, your butt, that they tend to not get nauseous, or they sort of bypass the gastrointestinal discomfort that you can get from it, which is nausea, maybe diarrhea, upset stomach. So, and to avoid that discomfort, try injecting in your glutes. You can inject in your shoulder, you can inject in your love handles, your lower back fat, your upper butt fat, but try to avoid the stomach area. For some reason, it tends to make people sick a little bit more. The next thing I wanted to go over is dosing. So everybody's starting off at 5 units, which is 0.05 milliliters of the medication. That's a really tiny injection. So I want you to notice after your first week, if you still, towards the end of the week, if you still feel hungry, or if you're having cravings, or if small amounts of food don't make you feel full. We all need to know this I need to know this in your check-ins, so that I can help you titrate the dose accordingly. Some of you are going to need me to step it up a little faster. We're going to go 5 units every 4 days, and at some point up to 10 units. Some of you are going to go a little slower. You're actually going to get a longer shelf life out of that medication. So it all based on your comfort, any GI distress, and if it's helping you with those cravings, so that you can use the time without the cravings to overcome your relationship with food. I have sent you 3 emails after you ordered. One is your new patient information. Please take a look at that. That's going to have a lot of common questions asked on basic principles of just how the companies run. The other 2 are going to be weight loss. There's your weight loss post-consult. That's going to go over how to eat. It is the most condensed version I could think of to send you in how to eat. You're going to want to read it over and over again, because I guarantee you missed stuff. The second one's called Meal Prep Template. That is going to be a structured daily format of you eating, waking up, meal 1, meal 2, meal 3, and the times in between when you go to the gym. So I have made that with color coding, so you could copy it and then paste it in a return email and then just fill it out. The protein source this morning was an egg. The carb source was this, in fact. And if you don't know your macros, that's fine. I just need a basic starting point from you, so that I can get an idea, so we can start making the right suggestions and progressing you towards weight loss. I don't want to just send you off with the medication and you not know how to eat, because if you don't fix your diet, then when you're done with the medication, you're going to be hungry again. You're not going to be eating the right things, and your digestion is going to be slowed down from the medication, because that's how it regulates your insulin. And then you're going to eat the wrong things, or too much of something, or not enough throughout the day. Slow digestion, you're going to gain everything back faster, and it's going to be harder for you to lose weight in the long run. So it's really, really important that we use this time to clean up your diet. And this could take 12 weeks. This could take 3 months. This could take 4 months. It could take 6 months. The average person that listens to me, exercises, and nails in on their diet loses about 14 pounds in their first vial, which roughly lasts about 2 months. So keep that in mind. Those who don't end up getting off the medication and once again calling me a few months later and trying to start it all over again. So really dial in on the nutrition. We're not dieting. What we're doing is creating a healthy relationship with food and creating lifestyle habits so that you know how to eat for you, your job, your lifestyle, whatever it is. Whatever obstacles you have, throw them at me in our check-ins, and that way we can come up with a strategy to overcome them and still have you on track with losing the weight and keeping the weight off. So that is all I wanted to recap for you. Take a look at those emails, send them back. I have timers set for your check-ins, but you can email me anytime with nutrition questions. You can text me anytime as well, and I will coach you. The more you interact with me, the more I'll interact with you.